Hey, g'day, welcome. I'm Jedynak, and today is International Podiatry Day. What an auspicious day for all of us foot fixers. Welcome to this session. This Facebook Live session is going to be specifically about the soft tissue rehab principles that many practitioners don't fully understand or maybe don't even use. And I am coming to you live because we've been receiving questions about soft tissue rehab since we released our top 5 exercises for the top 5 rehab exercises for plantar heel pains. So the questions that have been coming through have been asking specifically about the plantar heel pain rehab process. And so what we're going to do today is we're going to cover some key factors. Going to define what soft tissue rehabilitation actually is, why soft tissue rehab is so important, particularly for plantar heel pain cases. We're going to look at the difference between short-term rehab and long-term rehab. We're also going to discuss the 3 phases of soft tissue rehab that you must follow to get the best clinical outcomes for your plantar heel pain patients. We are going to look at the clinical actions, the typical clinical actions that most practitioners do inside their clinics when they're dealing with plantar heel pain cases, including major mistake numero uno. So it's the number 1 mistake that commonly gets done. We're going to explore that and what to do instead. But then again, as an accomplished practitioner, you're probably not making this mistake. However, stay tuned and find out if that's actually the case with you. Then we'll also look at where do you start? What's the starting point for plantar heel pain rehab, and how are we going to be able to make the most of getting the most efficient results for our patients? So let's get underway. First of all, we're going to define what is soft tissue rehab. Now, soft tissue rehab is basically therapy modalities that are used to assist nature. And we're going to assist nature in reducing inflammation. We need to assist in the promotion of healing, and we're also going to reduce the risk of complications through our interventions and the treatments so that our patients improve as quickly as possible. Now, this is really important because the key goal for us as practitioners is to make sure that our patients get the quickest results that's physically possible so they can get back into the things that are important to them. And what we're going to explore in, I guess we really need to clarify, is the difference between quality rehab and symptom relief. And this comes down to a key fundamental physiological element, and that is, what is true healing? Now, I'm asking you that question right now. So what is true healing? How would you answer that? Look, I can tell you, when we run our workshops and we pose this question to our audience, there's, apart from the blank stares and the discomfort, I don't want to say anything in case I'm wrong, but mostly it's about symptom relief. People respond with, restoration of mobility, able to do their activities. And the thing that I'm going to emphasize for you, if you only get one thing from today's session, it's this. It's understanding what true healing really is. True healing, physiologically, is when old damaged cells are replaced with new healthy cells. Now, it's kind of a bit of a BFO, a blinding flash of the obvious, but if we consider that physiological fact, that true healing is when the old damaged cells are replaced with new healthy cells, it actually puts us in the time frame, or puts us in the mindset of what we need to do for our rehabilitation. Because with soft tissue rehab, we need to work with nature, and we need to work with the time frame of what true healing and replacement of those damaged cells are. So true healing, damage of the old cells, replaced with new healthy cells. When we're dealing with plantar heel pains, we're often dealing with the tough fibrous tissues in and around the plantar fascia, the enthesis, the deep tendons, the strong structures, the structures that are designed for weight bearing and supporting the body. And What we can know from detailed studies, and these studies in particular were done in Scandinavia, where their ethics regulations or guidelines are a little bit different from the rest of the world. What they did is they injected radiographic isotopes into collagenous tissues, ligaments, tendons, and the joint capsules, and then they measured how long it takes for those old cells, or for those cells, to be replaced with new healthy cells. How long do you think that is for ligamentous tissues? Now, it's an important situation, or important physiological fact for us to contemplate, because different tissues turn over at different rates. Like muscle tissue, striated muscles, like in your biceps. Yeah, I know, it's not much of a bicep to show off, but anyway, in my biceps, if I damaged the muscles here, it takes around 10 to 12 days. I mean, think of if you get a bruise in the arm, you know, as a kid, you got a punch in the arm, and you get a bruise there. How long does it take for that bruise to, you know, eventually fade, it goes a bit yellow, and then the tissue's completely recovered? It's usually around 10 or 12 days. And the research, some say 10, some say 12 days, so, you know, it's around that mark. Collagenous tissues, those deep ligaments, tendons, and joint capsules, those Scandinavian studies, Kier et al., have documented and reported that it takes around 6 weeks. And if you think about that, you know, a ligament, a good ankle inversion sprain, damaged ligaments, you might be able to get mobility and restoration and action happening sooner, you know, the first 10 days, 2 weeks, 3 weeks. But true healing, the replacement of old damaged cells with those new healthy cells, will take around 6 weeks with collagenous tissues. So when we're dealing with plantar heel pains and we're dealing with those deep tissues and insertions into the bones and the attachments and the periosteum, then we need to pay attention to the laws of nature and that 6-week cycle of turning over. So this is an crucial point, because I mentioned about soft tissue rehab and short-term modality. The short-term modalities are typically things like temperature, you know, ice therapy, maybe heat, and then we'll use other interventions. It might be like sound waves, ultrasound, magnets, lasers. These type of short-term therapy modalities are about getting relief of symptoms in the short term. Think of it a bit like anti-inflammatory medication, you know, non-steroidal anti-inflammatory drugs. They will be designed to get relief of symptoms and get your patients feeling as comfortable as quickly as possible. It's not true healing. What it is the relief of symptoms. Long-term soft tissue rehab typically involves an exercise routine. You may also find that there is things like gait retraining, re-education, reprogramming of the neurological input into the muscles. This is over a longer period of time, and we need to work with the nature turning over those damaged collagenous tissues and restoring, getting as much relief and rehabilitation of those affected tissues. So hopefully that makes sense. That's what true healing is. We're looking at, typically with plantar heel pains, a 6-week period of time that we'll be working on. Now, I mentioned about the typical clinical presentation. You know, imagine this: you have a patient, they come in to see you, and your plantar heel pain presentation. You do your biomechanical assessment, you do your muscle testing, and then you find muscles that have demonstrating or presenting as being weak. So, what are we going to do for weak muscles? Is that an obvious question? Well, obviously we've got to strengthen them, don't we? Well, let me tell you, mistake number one, numero uno, is trying to strengthen those muscles at the beginning of your rehabilitation. The reason why I say that, let's just kind of step back a little bit here and go, well, what is the reason? Why are those muscles weak in the first place? And typically they're weak because they've been overworked, they've been fatigued, they've been stressed and strained, they're probably damaged, so it's no wonder they're weak. If you then go and try and strengthen those muscles which are weak, fatigued and damaged, your chances of causing more damage, reasonably high. But secondly, what happens is the body, your patient will start, okay, well, geez, they paid their 80, 90, 100 bucks to see you, better follow your advice. And you're doing these strengthening exercises, and what they will do is find ways to compensate or work around or do them to the best of their ability. But if those tissues are damaged, it's unlikely that they're going to get good form and good rehabilitation taking place in those tissues. So, mistake number one, now I know you wouldn't be doing this, but if you start off your treatment with muscle strengthening, you're just asking for trouble. The second thing to take into account is that the muscles we're dealing with, when we're dealing with plantar heel pain problems as well as lower limb problems, is we're dealing with a lot of postural muscles. And those postural muscles rely on the appropriate afferent input from the brain that takes the proprioceptive feedback from the mechanoreceptors, and then it works out, okay, what do we need to do here? And it'll work on those muscles. If those muscles are tib post and peroneus longus, these are classic stabilizing muscles that if they're fatigued and damaged, and then you're trying to strengthen them and get them to do more work, can you see how this might interfere or disrupt your actual rehabilitation and recovery process? If that makes sense, hit a like, hit a heart, hit a face, hit a side, I don't know, hit one of those buttons down there. Sorry, I'm not the techno whiz, but you can do that and join in the conversation here. Okay, so if we're not going to strengthen the muscles, first of all, what are we going to do? Okay, we've got to pay attention to the physiological law of the 3 phases of soft tissue rehab. Phase number 1, and that is stretch. Phase number 2, strengthen. And then phase number 3 is stabilize. And so the key thing, I'm pointing out, having a go with my dowel here, because this is one of the important stretching exercises that have been shown to be very effective in the early stages of rehabilitation of soft tissues for plantar heel pain conditions. So phase 1, when you start your rehab with plantar heel pain, is, in fact, even before the stretching, you need to rest those tissues. If they're fatigued, damaged, and overworked, give them a chance to recover. So gentle massaging is also a nice thing to do to help stimulate the recovery. But the crucial factor here is to not strengthen and begin the stretching routine. If you're not sure which stretching exercise you should do and whether you need high-tech equipment like a piece of wood, then what you need to do is, if you haven't already, download the free report that we've got for you, the top 5 rehab exercises for plantar heel pains. It's attached to this post, there's a link there. I'm presuming it's all going to work for you immediately. If not, it'll happen as soon as I finish, which will be in just a few minutes' time. Okay, so the important thing that you need to be mindful of is when you begin your rehab, start with the stretch. And you must continue that stretching routine and the resting stretching only until your patient is ready to begin the strengthening routine. Okay, so now your question is, well, how do I know when they're actually ready for the strengthening? I am so glad you asked, because that's exactly the topic of our next section, which will be happening in just a couple of days' time. So, to recap what we have covered today, we have gone through defining what soft tissue rehab actually is. We've talked about why soft tissue rehabilitation is so important for your treatments for your plantar heel pain cases. We've looked at the types of soft tissue rehab, short-term and long-term. We also looked at the 3 phases of soft tissue rehab, the physiological principles that are crucial for your effective treatment of your plantar heel pain cases. And we've also gone through the typical clinical actions that happen and major mistake numero uno that tends to get done in too many clinics. Next time, we will go through the benchmarks of when your patient graduates, when they're ready to graduate. I'm not sure if you can hear that, but that's a bit of a thunderstorm brewing. So I think it's also another way for someone with more powers than me saying, come on, let's wind it up and bring this thing in for a landing. That's what we're going to be covering, is how to tell when your patient is going into the strengthening phase and what the crucial exercises are for your plantar heel pain rehabilitation strengthening. The next thing that we have is... yes, look, I know I've kind of come at you and thrown a lot of things down the ether web right here. If you have questions, please make sure you send them in. Message me, direct message, or email me. Ted, oh no, actually this one here, the best email is help, H-E-L-P, at plantarhealpain.com. And then that way I know it'll be specifically related to here. If there's any other questions or any comments you've got to make, please enter them into the comments box below. If you have other important comments to make about the weather, or I was going to say the Jesus look, but of course it's not really the Jesus look because he didn't wear glasses. Anyway, so and to our good friends all'Italia, when they learnt the expression "Oh my Ted." I know we in English say "Oh my God," but in Italian it translates to "Oh my Ted." Allora, buongiorno a tutti. Come sta? Bene, grazie a voi. Allora, okay. So here we go. We are now going to have. Oh, thank you very much, Gaz. And look. He just said, nice to have you back. But it's also my front is here and my sides are here as well. So it's good to have all of me here.
And it's good to be back.
I'm not sure it's all of me here. Lil has reminded me that it is good to be back and we enjoy all that the world's there. Here we are in Byron Bay. Glorious, it was glorious this morning. Worked on my tan and also went for a bit of a dip in Watergoes Beach. But the thunderstorm's coming, so yeah. How Byron Bay is that? Until next time. Remember though, download your freebie. It's a great resource to have. Top 5 exercises for Plantar Heel Rehab. Until next time, serve with spirit, consult with care, and help more heels by stretching first. Do that today. Ciao.